Bob and Brad, the two most famous physical therapists on the internet.
Howdy, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
And
therapist.
together we are the most famous physical therapists on the internet.
In our opinion, of course,
Emphasize that
Bob.
I'm famous.
Famous.
So we're going to talk about shoulder impingement exercises. And at the end of the video, we're going to show you how to get a printout, a free printout of exercises and everything you need to know.
Yep, little review of this whole video. It's wonderful information, and we'll, like I say, we'll inform you a
We'll
little.
give you the details.
Right. So, Bob, we're going to actually refer to one of our some of the information, a lot of the information and treatment on this from Dr. Kirsch,
Right.
who has written a book, and he's got like 5 editions
Right.
updated on shoulder pain. And he refers, and I think pretty much anyone will agree, the majority of shoulder pain is from impingement,
Right.
unless it's trauma. You fell or in a car accident or something like that. That may be a different
And I found
story.
that to be true.
Yeah,
Pretty
I
true.
think most
Yeah.
people who work with a lot of shoulder pain will not disagree with that.
Right.
So we're talking about typical symptoms of shoulder pain with impingement is if you reach up overhead, you get pain, particularly over 90 degrees is here when you get up here. And oftentimes it presents itself with maybe not when you're up, but when you're grab something or you just come down,
Right.
and then it hurts on the way down. It's very
Yes.
common. And then that painful arc syndrome where you feel pain here, but once you get up higher, it's better. And then when you come back down, there's that painful range. And boy, that fits right in with
You want to show on Sam?
yeah,
maybe?
with the concept that Dr. Kirsch
Right.
talks about. He's, I thought he was crazy when I first
Right.
heard about this guy about 8 years ago.
We were skeptical.
Yeah, and then we read his book and we understood it.
We became believers.
Yep. So let's look at Sam. Oh, his jaw. We got an issue there.
Dislocation.
Let's look at the impingement area of the shoulder. You can see this pink area, which is
The
represent-
supraspinatus tendon.
Yep, that's the tendon. The muscle is back here. And if you look here, when you go up right here, that gets pinched. So if I put my finger in there, if I pretended my pinky was a thick tendon, ow, it hurts. So
It only gets pinched if things are a little bit out of alignment.
yes,
And not quite working right. So
exactly. Sometimes you get some bone spurs right here on this
Right.
bone, and that can cause a decrease in the gap and
right.
part of the problem. So anyways, there is your problem area, and we're going to talk about how to treat that.
Right.
So
Couple of simple ones.
yeah, and we're going to go right to
By the way, we should mention our giveaway. We
Oh,
are giving
yeah.
away the Bob and Brad grip strengthening kit.
kit. Yeah. Boy, it comes with 4 or 5 different things.
Yeah, it's great for rehab. This is probably the bulk of the kit right here.
Yep.
You can actually do grip strengthening, and it keeps has a little counter on it
Mm,
that every time you do a rep, it keeps track of it. So I'm at 81,
yeah. You just keep going, Bob.
and you can also tighten it or loosen it.
Yep.
based
The
upon
resistance.
what
They got the individual finger ones, a little rubber egg one for the different grip. It's complete. It's a
Yep.
wonderful system. All right, Bob, let's get on with,
All right.
with our, well, we're going to go right into hanging where Dr. Kirsch
Sure.
talks about. So for this, we've got an option if you don't have a pull-up bar. We use the hanging handles against the wall, which I think is a step above the pull-up bar. And then we're going to show you an option where you don't need to have.
You could hang on your rafters. You could hang on a branch if you had one. But I
Yeah.
mean, you can.
He
you know.
talks in the book, he talks
Yeah.
about all the things you can do to hang. So the idea is, it's like when I said you go up, once you get up so high, you oftentimes don't feel the pain. Well, that kind of is the same idea when you do a hanging. Your arms are overhead and you slowly let down with the resist or your body weight. So I'm doing that now. And you go until, if you start getting pain, you're not going to go into the pain until it's real sharp. Although he does say
You
you'll,
want some pain.
yep, some pain.
Right.
And you may start hanging just partial weight for 10 minutes or 10 minutes,
10 minutes.
10 seconds.
Yeah, I would, recommend starting off very slow.
Yes.
And
Progress into this.
right.
And then, as you go more, you may go to full weight bearing if everything is feeling better after a
See
few
Brad's
days.
taking his feet up
Yep.
in the air.
Yep. And he talks about going up into like a couple minutes,
Right.
which I never go that far.
I've never done that either.
But
Yeah.
he has people that do it, and they have different ways to hang on that. And
Right.
but for this purpose, I think we'll do fine without going to the extreme.
There's a lot of testimonials in the book.
Oh yeah,
People that were headed for surgery and actually avoided it.
right.
But some of them were saying they only go for like 20 seconds or 30 seconds.
But
They aren't going for minutes.
And as long as it's doing well, it feels once you
Right.
do it for all,
Long
it
as
feels
you're
good.
progressing.
Yep. And the next day it doesn't get all flared up. Make sure you
Right.
test it the first day that you do it. If you don't have that, we have an option. This is not in the book. This is kind of our
Right. This
little
is
invention.
our doing.
So you take a stick. It's good to have it about 1 inch to 1.5 inches in diameter
You
and
could
about
use
4 feet
PVC
long,
piping, or you could use a broomstick.
or a piece of doweling, something that you can grab hold that's not slippery. And I'm going to start right here. I'm going to put this on the chair. You can start on the ground depending on how high is comfortable
Or how
for
tall
you.
you are.
Exactly. But you can see, and I'm going to grab here, go up as high as I can. And what I'm going to do is lean forward. Oops, sorry about that, Tanner.
Puts a lot of traction on the shoulder.
Yeah, it really, the ratio of torque on or pressure traction is a lot more than than what you can
Brad,
see.
why don't you show how some people start off? They're down quite a bit.
Yeah, you may
because-
start here.
Yeah, exactly, because they don't have much range
Yeah.
to start.
And I guess for impingement, if you can get past that painful point and it's
Right.
okay,
Right.
then you
You
can go up
might
to
use
here.
the other arm to even lift
Yeah.
you up a little bit to get to the
Yeah.
top.
And so we're looking for that stretch, and I'm leaning forward, and right now I'm getting a good stretch in here. And as you get better, you may get way up like this, and just allow it to stretch, getting that similar treatment, and do that 2 or 3 times.
This is the booyah stick, by the way.
Right? Yeah, it works.
Booyah.
It works really good because it's very
really
grippy. It's got the nice rubber ends that prevent it from slipping.
But you can again get by with less.
Mm.
You can do a broomstick and even put some tape on the bottom of the broomstick. And,
Yeah, I've had people use a
unscrew it.
mop.
Oh, have you?
And put it on carpet so it doesn't slip, and then the
Sure,
mop head stays there.
Makes sense. Makes
Yeah,
sense.
yeah. Be creative. That's what we always do. Now, the next thing we want to do is work on strengthening those rotator cuff muscles, and the two very common and
Yeah.
successful exercises. We'll start. I'll show you this.
I think the W's.
Yeah.
Because anybody can do these,
Mhm.
and they can do it without equipment to start off with, and you do them throughout the day. You don't just do them once.
Yeah.
You want to do it like 6 to 8 times. I mean,
Yeah. And we're only going to do 10 at a time. It's not like you're going to do them for 20 minutes.
I've had patients that actually this alone improved their situation.
Right.
So
I want to explain to them how critical it is to squeeze those shoulder blades
right,
back.
he's actually tightening the muscles up here, bringing the blades together, and you're improving the posture muscles.
Yeah. So once those shoulder blades get where they're supposed to, all of a sudden, oftentimes you get a much better mechanics, less pain, just because positioning the shoulder blades.
You're opening up the gap a little bit.
Yep.
Just by doing that.
The other thing that you can do is sometimes it's nice to have a little resistance with that.
Yeah.
You get yourself some stretch tube like we have here, anchor it somewhere. We got the wall anchor on here. You can put it around a doorknob, or they actually have a door adapter in these tube kits. Almost all of them do. And you're going to do the same thing with some resistance. Now, you can do the W like we were doing before. A lot of times I'll have people say, go like this, and tell them about putting the shoulder blades into the opposite pocket so you get the right muscles working.
It's just a visual, something to think about. So this shoulder blade, you're actually trying to put down into this pocket,
Yep.
and this shoulder blade down into the right pocket.
Yep.
Now, obviously, you're not going to be able to do it, but it just a visualization and what you're trying to do helps put the shoulder blades in the right spot.
Right. Get the proper muscle fibers working. And then after you do 10 of that, then now with this exercise, you do need to have a stretch band, or you can use a weight and lie down on your side. I like to do it standing just because it's more functional.
And sometimes we actually have you grab a towel and put it underneath your arm.
Ah, yes.
Keep your arm in the right position.
Yeah, this is critical to get the proper rotator cuff.
Because what you don't want to do is show it the wrong way,
Yeah,
Brad.
so if I let this come out and it drops down, it's no
He's got a
good.
flying elbow there.
Yeah. I'll usually have people do this, and after a couple days of using the towel,
They can take it out.
yeah, take it out, and then they just maintain that as
Right.
opposed to doing this or this. So we're going to do 10 of these. I usually combine it. 10 of these, maybe up to 15, and then right away do 10 of
Right.
these,
Right.
and then rest a little bit, and then do another set of 10,
Sure.
each one of them. And that's a real nice rotator cuff strengthening exercise to stabilize that joint.
Yeah, it's strengthening two of the muscles of the rotator cuff, of which there are 4.
Exactly. Bob, this is a moment they've been waiting for.
Oh, yes.
They're waiting for, how are they going to get the PDF printout so they can look at
So,
this, print it out, and
what
have
you want to do
pictures?
is go to bobandbrad.com, bobandbrad.com, and go to the program section. Under the programs, we have one listed on treatment of shoulders.
Mhm.
And if you look through it, there'll be a whole series.
Right. You're
And-
going to find nice
yeah.
pictures of each
And
video.
there's a PDF
Yeah.
with each video.
Yeah, people are thinking, oh, this is some kind of scam. It's
No.
absolutely free. There's absolutely nothing, not even
we
an
don't
email.
ask for email. This is our gift to you.
Right.
And you check it out. It'll be helpful.
And you're going to find exercises for the rotator cuff. Look at that video. You don't have to watch the video. You can just, on the side, you can say hit print out. It'll print out these exercises. And
Well, you'll find a video on
Oh, yeah.
impingement.
yeah, and you're going to
So,
find some other videos that will pertain to
Right.
you and be helpful for your situation
everything
as well.
you need to know about the shoulder.
Yep, without
So-
searching the worldwide internet
Right.
trying to figure out which one is going to be good. So
Check it
very
out.
good. Print away, be careful. And once again, Bob and I can fix just about anything
Except for a broken heart.
yeah, and
It
that's
just bewilders us.
yeah, but we'll continue. We are relentless,
right.
even if we're not successful.